Hi, I'm Rich Colgard, publisher of Forbes. You won't want to miss the next video with Linda Reed, Chief Information Officer for Atlantic Health, in conversation with Peter High of Meta Strategies, talking about the Affordable Health Care Act and how that impacts healthcare technology, and Linda's own inspirational story of how she rose from being a registered nurse to CIO of Atlantic Health.
Linda, welcome to this conversation at Forbes. It's great to have you.
It's my pleasure.
I thought we'd begin with the Affordable Care Act. Obviously, it's getting, understandably, a lot of press these days. In some cases, also, the technology behind it is getting the wrong kind of press.
Right.
Some of the hiccups in enacting some of the technology to support
we all knew it was going to happen. Right? We just had to see how it was going, and it was like, ooh, they're going to have one of those projects that none of us ever want to have.
Well, I wonder, in operating with the degree of uncertainty as to exactly what the Affordable Care Act, how it's going to be implemented, but having to actually be strategic with your own investments and, and planning in your own environment, how do you take into consideration the moving parts that make up the Affordable Care Act?
Well, it's interesting because I think the parts that have to do with the insurance exchanges, we're not 100% sure how that's going to impact us yet. Hopefully it'll impact us positively, because the whole premise was if more people have insurance, the less uncompensated care we'll have to provide, because more people will come into the hospital environment with insurance.
You are, among other things, an IT executive in this organization.
I am.
And you've had a very unusual path to that role. You started as an RN.
I did.
Yeah, as a registered nurse in the organization. And so I wondered if you could talk a little bit about that very unusual path from RN to CIO.
Well, it's interesting because when I started in healthcare as an RN, there were barely any IT systems at all. There was maybe a lab system. There was a rudimentary patient accounting system that would help you put out a bill. But other than that, there was really nothing else. So I was an ICU nurse, so of course you're comfortable with technology. I'm very comfortable banging on any kind of monitor, putting tape on it, using things to make sure it works. And then as we started kind of getting into, I guess the growth started coming when they really had to do more billing, right? More automated billing. And we saw the growth of companies like Shared Medical Systems and HBOC that started putting out patient accounting products. The issue there was that they were patient accounting products, and so they sold them to those of us in the clinical areas, kind of like clinical systems, but they weren't. It was really just to be able to count and put out bills. Then we started seeing the first beginnings of having some clinical systems, and as we started doing that, it became, I think, a little more important to have some people with clinical skills help put these systems together. So I was asked by the director of nursing at the time if I would take on a clinical project, IT project, and who knew? I was a nurse, mainframe, PC, who knew the difference? So I said yes. And the next thing you know, here I am about 22 years later, and I'm the Chief Information Officer. It was a job a title that didn't really even exist at the time. When I first started. As
you started to pull away from your traditional experience and background as a nurse and got more involved in technology, what attracted you to that? I
think what attracted me to it was that you needed people who really had an interest in taking the best care of patients that you could possibly have to sit down and work on these systems. You really wanted them to be able to match up with the workflow, the clinical workflow, as much as you could. Because if you don't have the right technology and you don't have the right information in those technologies, you could almost really harm a patient. So you really want someone with a clinical background, a clinical understanding, who really can help you put these systems together. At the end of the day, I also had a concern about my clinical peers. A lot of these systems don't necessarily work well in the clinical environment. You need your hands in a clinical environment. And to be able to use some of these, you have to be typing. Typing and touching a patient don't always go together. So it doesn't always, I'm not always successful, but I always go into it with, how is this going to impact both the patient and the person having to take care of the patient?
And there are those who say that a CIO needs to have had experience as a programmer and have a computer science background and have sort of really base level of knowledge and technology that starts from the very sort of beginnings of it, in essence. Right. Obviously, that wasn't your story, and I wonder, as you began to take on more responsibilities in IT, how did you fill in the gaps that you saw in yourself in terms of having team members who maybe had different sets of experiences from your own?
Surely, and you know, and it is a team sport, right? IT and healthcare truly is a team sport, and I have the greatest team. I have a number of directors that are very much, they've been doing IT since they were younger than I care to tell you. But then I also have some that came out of the clinical areas also, and I have a physician. And having all those perspectives in one place is really very important.
It would make sense actually in some ways that given the major leap you took from RN to CIO, that you've been given more recently a separate set of responsibilities. You're actually also the Vice President of Integrated and Behavioral Medicine at Atlantic Health. Can you talk a bit about that second role and the logic of your responsibilities and experience as CIO and how they lend themselves to this additional set of responsibilities you've taken on?
The thing that made me a good CIO really was being a good nurse, and I think that's because nurses are the ultimate multitaskers. We think in terms of how you get things done, and what is that? That's a project manager, right? So moving into IT from nursing really worked out for me because I think in terms of a project, I think in terms of how to get things done, and I've been successful at it. I think at Atlantic Health, we had a very robust integrative medicine program, and for anyone who doesn't know integrative medicine, it has to do with acupuncture, massage. It's all the soft stuff that sometimes people may not think is real medicine, but it is, and it's growing. It's starting to be called functional medicine, really, and it really has to do with your gut and how your gut is your secondary immune system. So although we had that for a very long time, it was in pieces. So I know when my boss took a look at that, I think he thought, who's good at putting pieces together? And who's good at kind of nurturing people that haven't been brought together in a long time? And that's what my job is as CIO. I bring people together, right? So in any kind of project, you sit down and my team and I will bring in the finance department, and then you bring in the pharmacy, and then you bring in nursing. And these are just groups that won't speak to each other, but you have to get them to do that. And integrative medicine was similar. And then behavioral health that got added on, I think, because I think he saw that I did a good job with integrative medicine. And behavioral health is another area where it's important. It doesn't always get the care that it deserves, and I think he knew that I would give it the care it needs.
So much of that's written about trends in healthcare seem to actually focus to some extent on two areas of your expertise. The fact that the role of the RN is becoming much more prominent.
That's true.
And actually serving, in many cases, functions that MDs in the past had
That's
served.
Right.
And then also the creative use of technology.
Right.
That as the cost of healthcare continues to rise, that technology may be one of those offsets to that. And so I wonder actually if you have any perspectives looking out, say, a few years' time, how some of the trends that you're seeing in these two areas and beyond, what sorts of things you're thinking about in terms of better leveraging technology and maybe even some of the things from your past as an RN?
Well, I think you're absolutely right, and I think what I could tell you right now that I see, and two of the things that we've been kind of working on and putting some bets on are mobility. So that's one of the big ones. People want to work off of the appropriate device. So whether it's your smartphone or a tablet or a workstation, they can use them for different reasons. And the second one is telemedicine, telehealth. So when you start putting together the telehealth with the mobility, I think you're going to see a whole different way to deliver health care. I think the statistic right now is that we're going to be short somewhere around 150,000 primary care physicians in the next 10 years. Nobody's sure where they're going to come from, but I just read an article, I guess it was just on NBC.com, that talked about how nurse practitioners and midwives in a lot of areas are as good as, or maybe even better than physicians. And I think that's what we're going to see. I think we're going to see a change in roles. You can just take a look at Walmart, right? Walmart, they're in their clinics. They kind of staff them with nurse practitioners. They'll telemedicine in a physician if it's needed. So I think we're going to see a whole change in the way healthcare is delivered because of the change in the technologies that we're seeing